Hello everyone, important one-liners in orthopedic oncology. Chicken wire calcifications are seen in chondroblastoma, also known as Codman's tumor. Soap bubble appearance and eggshell crackling and palpation are seen in osteoclastoma, also known as giant cell tumor. Closest variant of giant cell tumor is aneurysmal bone cyst. Most common variant of giant cell tumor is non-ossifying fibroma. Pulsatile bone lesions. In primary bone tumors, pulsatile lesions are seen in. It is a code is it is a mnemonic. Gate is a mnemonic. G is giant cell tumor. A is aneurysmal bone cyst. TE is telangiectatic osteosarcoma. I will write it. Giant cell tumor. A is aneurysmal bone cyst and T is telangiectatic osteosarcoma. In secondary bone tumors, pulsatile secondary bone tumors are renal cell carcinoma, follicular carcinoma of thyroid. Bone to bone metastases are seen in. It is a mnemonic. Bone to bone. B is bone to bone metastasis. O is osteosarcoma. N is neuroblastoma. E is Ewing sarcoma. So bone to bone metastases are seen in three conditions: osteosarcoma, neuroblastoma and Ewing sarcoma. Codman's triangle and sunburst appearance are seen in osteosarcoma. Nora's lesions are seen in osteochondroma. Olier's disease. Olier's disease is a non-hereditary condition. Multiple enchondromatosis are present. Maffucci's syndrome. It is a hereditary multiple enchondromatosis with cavernous hemangioma and phleboliths. Onion peel appearance and permeative lytic lesions are seen in Ewing sarcoma. Mottled or popcorn calcifications are seen in chondrosarcoma. Ground glass appearance and rind sign are seen in fibrous dysplasia. Most common extraskeletal manifestations of fibrous dysplasia is McCune-Albright syndrome is it consists of precocious puberty, polyostotic fibrous dysplasia, capsulate spots, and the mutation is present in GNAS gene, GNAS gene. And Mazza-Brad syndrome. Mazza-Brad syndrome is polyostotic fibrous dysplasia plus intramural myxoma are present. Next, most common radiation-induced bone tumor is osteosarcoma. Most common radio-resistant bone tumor is osteosarcoma. Most chemo and radio-sensitive tumor is Ewing sarcoma in bone tumors. Most common benign bone tumor is osteochondroma. It is also known as exostosis. Most common true benign tumor is osteoid osteoma. Most common primary malignant bone tumor is osteosarcoma. Most common primary malignant bone tumor leading to pulmonary metastasis is osteosarcoma. Most common malignant chest wall tumor is chondrosarcoma. Most common benign bone tumor in children is simple bone cyst. Most common primary malignant bone tumor in children is Ewing sarcoma. Most common primary malignant bone tumor in adults is osteosarcoma. Most common primary malignant bone tumor in elderly is chondrosarcoma. Most common malignant bone tumor is secondaries. Most common primary malignant bone tumor is multiple myeloma, more than osteosarcoma, more than Ewing sarcoma. Most common primary malignant bone tumor to show bone-to-bone secondaries is Ewing sarcoma more than osteosarcoma. Most common primary to give bone secondaries is breast carcinoma more than prostate carcinoma more than lung carcinoma. Most common tumor of jaw is squamous cell carcinoma. Most common bone tumor of jaw is ameloblastoma. Most common site of bone metastasis are going to lung, more than liver, more than skeleton. Most common malignant tumor of hand is squamous cell carcinoma. Most common malignant bone tumor of hand is chondrosarcoma. Most common tumor of hand bones is enchondroma.